For the causative agents, here are the types of pneumonia. We have the community-acquired typical and atypical pneumonia, nosocomial pneumonia, aspiration pneumonia, chronic pneumonia, necrotizing pneumonia and lung abscess, and the pneumonia in the immunocompromised patients. And in here, we have their corresponding causative agents.
Pathophysiology of pneumonia. Any infectious organisms that reach the alveoli are likely to be highly virulent as they have already evaded the host's physical defense mechanisms. Consequently, they may overwhelm the macrophages, resulting in production of fibrin-rich exudate that fills the infected and neighboring alveolar spaces, causing them to stick together, rendering them airless. The inflammatory response also results in a proliferation of neutrophils. This can damage the lung tissue, leading to fibrosis and pulmonary edema, which also impairs lung expansion. The inflammatory response can also lead to the development of a pleural effusion, which is thought to complicate up to 40% of cases of pneumonia. These changes result in a reduced gaseous exchange. As a result, vital organs become oxygen deprived, and the respiratory effort required with each breath will be increased as a result of the disturbance in normal physiology. Respiratory and heart rate will increase in response to falling oxygen and rising carbon dioxide levels.
Prevention of pneumonia in children is an essential component of a strategy to reduce child mortality. The most effective way to prevent pneumonia is immunization against Haemophilus influenza B, pneumococcus, measles, and pertussis. Adequate nutrition is the key to improve children's natural defenses, starting with exclusive breastfeeding for the first 6 months of life. Reduce the length of illness if a child does become ill is effective in preventing pneumonia. Addressing environmental factors such as indoor air pollution by providing affordable clean indoor stove, for example, and encouraging good hygiene in crowded homes also reduces the number of children who fall ill with pneumonia. In children infected with HIV, the antibiotic cotrimoxazole is given daily to decrease the risk of contracting pneumonia.
Monitoring of pneumonia patients. Blood test, chest x-ray, sputum test. CT scan, pleural fluid culture. Patient education. Get flu vaccine, stay hydrated. Get a pneumonia vaccine, and don't smoke. Take medicine as prescribed. Stay active. Thank you!